on physical activity for public health planning. There can be nothing better to be doing on a Chili Pepper, Texas summer than sitting through a variety of fascinating webinars on societal-based sectors and what each can do and what the U.S. National Physical Activity Plan recommends we do to help promote physical activity in the state. A couple of premises that we operate from on this webinar series is, first, if you're going to do any planning at all, and therefore evaluate any effects, measure any changes, or to improve public health, you've got to have planning. You've got to have a plan to move forward so you know where you're going. And one of the things that we will be benefiting from in the state of Texas is a revision of our dormant physical activity plan, what we called Active Texas 2020 when it began in 2008, and we're revising it now to be Active Texas 2030. In 2008, just after I arrived in Austin at the university, where I worked with the Texas Governor's Commission on Physical Fitness, put together the first state plan. It actually predated the U.S. National Physical Activity Plan. That's good. That shows we were out in front, but it's also bad in that it didn't, as the National Physical Activity Plan evolved, it became clear that the Texas plan didn't sector-based approach, a societal sector-based approach to determining how physical activity promotion, what evidence-informed strategies might be working. Along with West Virginia, we remain the only two states that have standalone physical activity plans. Sometimes you'll find it buried in chronic disease plans and other kind of places, but a standalone physical activity plan, I think, gives the importance of physical activity its due. We're operating on the idea that all health is local. And that statement is a huge statement, I think, and it has lots of implications because while things like the National Physical Activity Plan and others, other kind of federal level plans are excellent starting places, they sometimes don't matter to people in El Paso or don't apply to people in the Panhandle or in the Rio Grande Valley. And so our plan with these seminars, with these webinars, is to engage stakeholders with ideas and opinions, experiences in each of the societal sectors to translate and to articulate the national plan into something that's usable in the state. My name is Bill Cole. I'm a professor at the University of Texas Health Science Center School of Public Health and part of the Michael and Susan Dell Center for Healthy Living based in Austin. These webinars couldn't be brought to us, I think, because I've learned something in every one of them without the support of the UT School of Public Health and Michael and Susan Dell Center, the Texas State Department of Health Services, as well as the Physical Activity Alliance in the United States. It's a fairly new organization under which the U.S. national plan sits, and we've been able to harness some of their resources as well to make these things happen. The resources, mostly of which are personal people resources, and each webinar has been chaired or has been presented by the chair of each of the societal sectors, and we're so fortunate today to have the chair of the faith-based settings sector to help us here, Dr. Elva Arredondo. There are 10 sectors. We'll put some things in the to the U.S. National Physical Activity Plan, and we'll put some links in the chat box as we go forward. We've already sector, media and communication, education, healthcare. Yesterday we had business and industry. Today is faith-based settings, and then tomorrow, if you're available, transportation, land. Well, even if you aren't available, it'll happen. Transportation, land use, and community design. So I hope you can find a way to join us as well for that. That's tomorrow at 1 p.m. Central Time. Speaker is Dr. Melissa Pop from Penn State University. As I alluded to, we have Dr. Elva Arredondo with us today from San Diego State. Is in the Department of Psych, but extremely fortunate to have her as the chair, the faith-based sector setting.
Some of the strategies our committee have been meeting about. So the strategies I'm going to present today is the work of a committee with diverse backgrounds and content experts, most of them in the physical activity space. We have behavioral scientists, we have exercise scientists, we have researchers who worked closely with faith-based settings. So the strategies that are not only informed by the direct work, but also by the evidence that has been published in research and also systematic reviews. So let's see if this works. Okay, good. Just to start off, why work in faith-based sectors or organizations? A large percentage of the US adults report some sort of religious affiliation. So the Pew research has shown findings that 36% of US adults report attending church at least once a month, and 30% report attending church more than just once a month. So these are very relevant settings for a large proportion of the communities that we're working with. And we know from systematic reviews that faith-based physical activity programs have had a positive impact on physical activity as well as other health outcomes, BMI, cardiovascular disease risk reduction, and so forth. So it's not surprised that physical activity programs work in faith-based organizations because churches are among very trusted organizations, especially in many minority communities. They have the personnel, they have a strong volunteer structure, they have physical space in many cases. A lot of the mission that the churches have aligns really well with public health values and goals. There's a lot of scripture in the Bible that supports promoting healthy living. It's a relatively an important health behavior. Just have regular converse. So it's really, to me, a really effective way of reaching large groups of people. So we know that physical activity programs work at the organizational level. There's been emerging research that show promising implementation strategies that have led to positive health behavior changes, including physical activity. And a lot of this work has been led by Sarah Wilcox and with African Americans. And there's been more emerging research with Latinos in other communities. So there's certain strategies at the organization that we really want to make sure we capitalize so we can really reach a large percentage of the communities and implement and sustain these programs. So what I'm going to do here real quick is just go over a set of 5 strategies, and I'm going to delve deeper into each of these strategies over the next few slides and talk about sort of why are we proposing some of these strategies? Where's the evidence around some of these strategies, and how can these strategies help us promote physical activity in diverse communities? So the first strategy, which is faith-based organizations should identify effective applications of the health ministries to promote physical activity. So we have proposed a series of strategies that capitalize on characteristics of the churches that have been linked with positive health outcomes. And we know from evidence that churches that have health ministry also tend to have health programming that have been sustained for a while. And we also, at least some of the work that I've been doing here in Southern California, that these churches that have the health ministries tend to have parishioners that tend to have higher physical activity levels. So we know it's a good thing when a church has a health ministry, and we also, it speaks to the climate and the culture of the church. So there's a lot of benefits of having a health ministry. And those that don't have health ministries, we really want to figure out how to help churches that don't have them to establish them, because we know these health ministries can promote and sustain these programs. And there's a group of people who really have the buy-in of the importance of promoting healthy living and physical activity. We want to be able to also, we know that churches also have groups of volunteers. Oftentimes they tend to be leaders of the ministries, and we can work with these volunteers to help develop some of these health ministries. But also we want to develop strategies to help train these volunteers and groups that have buy-in on the importance of promoting physical activity in the church. So we don't have a lot out there in terms of training programs. So we really need to think about how can we increase the capacity of each church to not just develop a health ministry, but also figure out ways to develop trainings for these individuals who are part of these health ministries to implement these health programs, including physical activity. So we also know from evidence that churches that have a culture or climate that promote physical activity are much more readily able and ready to implement and adopt a program and likely sustain it, although we still are collecting evidence on that. And so over the next few slides, I'm going to be talking about some of the strategies that the committee has proposed to really help create a culture and climate within the church that promotes health and physical activity. So the second strategy is, so faith-based organizations should establish partnerships with organizations from other sectors to promote physical activity in a manner that's consistent with their values, beliefs, and practices. So it's no secret, churches have limited resources. They rely heavily on volunteers to implement the program. So oftentimes it's going to be a hard sell to ask them to allocate some of those resources to promote physical activity. So we really need to think about, well, what kind of partnerships are going to help support these physical activity programs? What partnerships are going to be able to really help churches adopt a physical activity program? So we have a lot of different sectors that we can identify whose mission is to promote health and also physical activity. So how can we create some of these linkages between the churches and these other sectors so that we can promote physical activity within the church? A lot of these sectors, like the hospitals, medical centers, I mean, their mission is to help prevent disease, prevent and also provide support for those who have the disease. But so they have allocated resources to do community engagement, to do health promotion, in some cases, like linkages so that these sectors that surround a lot of these churches can really help promote activity in the churches. We also know universities have physical activity programs, exercise science programs, where like Dr. DeRose is actually doing a program where she's helping identify exercise scientists to come in and lead physical activity classes in parks and churches. So there's definitely no shortage of opportunities and resources outside of the church, especially. So some of these tactics are really to help lay the ground to create and support some of these linkages, and more importantly, sustainment of these programs, right? So moving on to the third strategy, which is large faith-based organizations and settings should institutionalize physical activity promotion programs for their employees, volunteers, and leaders. So large churches tend to have more resources. They tend to have parishioners who have higher level of income. And they also tend to have an infrastructure that can institutionalize physical activity programs. So they may be more ready to implement and adopt and sustain a program than perhaps churches that have less resources and perhaps not the infrastructure. So how can we capitalize on our relationships with large churches so that we can really help embed some of these programs within the large church context? And we can really borrow a lot from what we've learned in the workplace literature, right? In terms of policy-related strategies. We know that at work, if there are policies, physical activity policies, people are more likely to be active. So how can we institutionalize and borrow what we've learned in this sector and apply it and adapt it to churches? So, how can we help church leaders develop some of these policies that are going to be well received by the parishioners? Would be a good strategy for us to consider. We need to be thinking about how can we better prepare our church leaders to help institutionalize these programs, not just by helping them consider some policies, but really how can we get them their buy-in, and how can we get them to really promote the importance of these policies among the parishioners? So there's a lot of layers that we need to be thinking about when we're thinking about institutionalizing physical activity programs. So let's see, I'm moving on to, I think I'm just kind of cruising on this, these strategies. So strategy 4, which is faith-based organizations should identify or develop marketing materials tailored for faith community leaders to enhance the perceptions of the value of physical activity. And this is really another important strategy because we know that leaders have a just powerful influence on parishioners. And we've collected a lot of anecdotal data from our interview data from parishioners and said, well, we see the father be active, that's incredibly inspiring. So how can we get their buy-in, given that they also have, right, a number of different responsibilities and commitments, is to me a big challenge. So engaging church leaders is an important strategy. And so we can do this by developing materials that highlight the value of physical activity. Oftentimes, in a lot of our recruitment materials, we quote scripture in the Bible that highlights the importance of taking care of one's body. We also are able to now that we've been able to implement this program, Faith in Action, we've been able to now talk about other church leaders who adopted a physical activity lifestyle and as examples and role models in the community. So we really need to make sure we engage them in this process as much as possible, because it's their lead that's really going to help influence the health and engagement of the parishioners. So really and each church has their own different culture. So, there's the Catholics who have very specific scripture, and then non-Catholics, Protestants who have also a very different Bible version of the Bible. And I think we need to be very thoughtful about how we're going to be linking the physical activity message to some of the values and the mission of the church and the culture as well. So aligning the messages is an important strategy, and also giving church leaders the tools to really speak to their parishioners about the importance of physical activity. So for instance, and working with church leaders, and most of who have really enrolled in physical activity programs, they say, we see the value, but I get stuck and talking about I get stuck in terms of how to promote and how to motivate individuals to be physically active. So of course they don't have training in health behavior change, and we don't expect them to. So I think that part of this engagement with church leaders is giving them the right tools to really be able to feel that they have the capacity and efficacy to implement physical activity programs. Because we've talked to a number of different leaders who see the value, but it stops there, and we really need to take it one step further with additional strategies. So, see, and finally, this is another really important one from my perspective as well, that we have evidence that physical activity programs in churches work. And we have rigorous evidence, but we can't expect church leaders or health ministries, to go into the research literature and sort of identify, which program may work best for the church. And we also have repositories, right, that NCI has in terms of evidence-based programs. We can't expect them to go in there. So we need to create this sort of repository or clearinghouses for churches that include resources on the different kinds of programs available, different kinds of trainings available for a lot of these churches, so that they themselves feel like, okay, there's really good information. I can pick and choose which programs feels like the right program for me, for this church, which program can help increase the capacity of some of my volunteers, which one can help increase my own capacity to implement this program. So we really need to think about strategies and in ways for us to really point our churches and church leaders into these types of resources. So I am going to pause there, and I know I probably went a little faster than I was expecting, but I imagine that there's a lot of questions, comments. I would love to hear from people's experiences. Hoping that this could become a little bit more interactive.
That's a great overview. Thank you very, very much, Dr. Arredondo. Would you mind releasing? Yeah, great. And I'll reshare. And as I've got, as people gathering their thoughts and comments, I've got a couple of key questions. I was sitting there listening, and I'm fairly familiar with strategies and tactics, but it struck me, we heard from Lori Witzel yesterday on the business and industry sector, and she did a similarly awesome job at overviewing what was happening. But I'm struck by the similarities oftentimes, particularly when you were, she made sure we heard loud and clear that the leaders in a business are engaged. The CEO, the HR folks, those kind of things in a large corporation who have those resources. And it just struck me that we have to engage the leaders of the mosque, of the temple, of the church in similarly the same way. And I'm wondering if there's if you know of any work or research about the best way to do that in a faith-based setting, appealing to what, I guess, is an important question as people here who might be interested in starting to activate a church or churches in their local communities. Where do they start? How can that become real?
Yeah, no, thank you, Bill. I definitely can speak to my experience in terms of what's worked with me, but I know that there's other individuals who've done this work much longer and have also been very successful at it as well. So how can, I guess to answer the specific question in terms of how can we engage some of these leaders, right? There's definitely leaders that we've talked to who are just, there's no convincing. They're so excited at the idea that we exist, or their programs, physical activity programs, because they tell us, look, Elva, we are going to funerals all the time. We see the importance of chronic disease prevention. We see people dying from cancer all the time. And we see we're, at the forefront of the health problems. And so they really see the value for the most part in terms of why we are doing this work. And the ones that are active are just also it's a very easy engagement for us, because they say, when I'm active, I mean, they see the direct benefits. I feel more energetic. I'm an effective leader. I talk to people, and I'm less exhausted. And sort of, I think it's folks, leaders who haven't had a physical activity lifestyle, who still see the importance, and they're still, well, let me sort of see if the committee, the ministries are on board. So let me sort of run this by them and see. So there needs to be a lot more sort of grassroots sort of buy-in before they themselves are like, okay, the community wants this, I'm on board. Versus those that have been doing this and see the program, they've worked with other universities, and they're like, I'm going to see how I can get my community on board. So, there's just different ways of like getting them at a place where they want to be partners in this work. So in terms of leadership, and in terms of training them, I think so. We're developing tools to try to give them at least the essentials to promote activity in their churches. So at minimum, health behavior change strategies, how to monitor their activity, how to help others, how to encourage others to monitor the activity, the value of monitoring the activity, things like that I feel like could give leaders more confidence in promoting physical activity, because they will know how if people ask, and it's going to be part of the messaging. So I feel that I think our biggest barrier there for us is time. We ask half a day to do a training, and they look at us like, are you nuts? Half a day, it's a long time. And we're like, really, for health behavior change? And I mean, but we obviously, we take what they can give, and that's better than nothing. And we let them know that we're around to help support and give them the messages and health promotion materials that they need and things like that. So did that answer your question, Bill?
Yeah, it did. It's a great approach, I think, and it's very similar, I think, to business and industry. Other kind of place-based things. Which reminds me to ask folk who are on the call, please just post a question in the chat box, or even if it's not a question, some experience that you've had in this area, so that others can learn. There is an email address at the bottom of this slide that if you don't want to share anything, or you want to share it with me directly, I can be reached right there at that email address for other additional comments, questions, and so forth. Elva, one of the things that we're trying to do with revising the Texas state plan is to do just what you talked about, which is cross-sectoral collaboration. So important. We all don't live just in churches. We all don't live just in our workplaces. We all don't live just in schools. We live across these sectors. And one of the sectors we have yet to hear from, to schedule, is public health, which is kind of critical. Do you have any suggestions or observations on how state and local public health people can work in this space? Particularly, churches, nonprofit, most private. Well, they're all private. They're nonprofit. at some level, it could be a clash of a public and private world. Others not so much, because churches can, as you pointed out, can always use assistance and help. Churches, synagogues, mosques, and so forth in the community. Any thoughts about uh, helping public health, local and state public health people work in this space?
Yeah, no, that's a great question too, Bill. And I'm not sure I have definitive answers, but we're trying to figure it out in this new grant and how to engage them. But in conducting interviews with them for our formative work, we learned that there are opportunities there to support this work in faith-based organizations. In fact, yesterday I had a meeting with interfaith counseling services here in San Diego, and it was the first time I met them. And we wanted to learn a little bit more about sort of the work that they do, because they're promoting some mental health in churches, and some of our churches were actually asking if there are ways for us to enhance our physical activity programs with mental health services. So I thought, oh, well, this would be a really good opportunity for us to sort of work with a very successful organization that actually is getting funding from the health department. So they were telling us that they had to be, they have this contract with the department in such way that they have to train almost like lay health advisors and on sort of on mental health service resources in the community and sort of how to identify mental health. But they said that they have to be accountable, basically have to do such, like they were accountable to a certain reach every year. And they're like, that's like so easy for us. So I'm like, there are a lot of really great models out there that people, the organizations have, that I think we can model after. So of course that, obviously we would have to understand what's in it for the public health department, in terms of what outcomes they want to see, what metrics they want to see changed. How do they, obviously they're accountable for their own resources. So it's figuring out like what the overlap is so that we can make that work.
Yeah, where the Venn diagrams overlap. Or what the Venn diagram looks like in an overlap. That's a great point, I think.
Exactly, because if they want us to show that we can help prevent cardiovascular diseases, then those are the measures that we need to make sure we act, right? So things like that, I think those are conversations that people should have early on in any program before even implementation, so that you can, at the end that you want your program to be sustained by these larger sectors.
Well, and in your example, and I do know, it's kind of a loaded question because I do know about your grant, but in your example, the Interfaith Council, interested in mental health, well, physical activity should be right there from an anxiety and depression standpoint. And that's something in it for everyone, right?
Exactly.
So a seat at the table in that regard, looking even not just church by church, but loose affiliates, stronger organizations, and it might be bound by geography or type of faith or target church members, target populations of church members. I think seems to make a lot of sense to me, at least. It's a lot to do in this space. There really is. So you shared with us the 5 kind of key strategies and the associated tactics and so forth. Even you, as superhuman, doing all the work that you do, can't do all of that at the same time. No one is able to do it. And as we try to get Texans to move into this space a little bit, flying the physical activity flag, where should folks start? What's the lowest hanging fruit of those 5 strategies that you think we should start? We can't throw everything against the wall and see what sticks. We have to be a little bit more strategic in that. What are some of your thoughts on that?
Well, I'll tell you which one might be the easiest for us right now. It's probably tailoring the messages that so that they align with the values of the church. I feel like we, in talking to church leaders and really listening to what's important to them and figuring out how can we highlight aspects of the program that really speaks to those values. So, for example, um, we've done interviews with churches where like Elva, social justice is our mission. We're driven by social justice, and so we're thinking about, well, how can we tailor a program to really align with those values? And obviously, talking about equity and the importance of having access to a healthy lifestyle, right, and prevention. And I think those are the kinds of messaging tailoring that I think would be important to start off the bat, because I think that if you're here and you're working with churches here, you know what I mean, it's going to be very limited engagement. So you really need to see how your program is really aligning with their priorities. So that to me is the lowest and easiest. I think figuring out these partnerships, it's feeling like a lot of work, but important work and well worth it. And I feel like we'll see the fruits of our efforts down the line. But I sort of feel like let's start off with making sure that this program makes sense to the churches that we're working with.
Yeah, great observation. I'll remind folks that we're doing question and answer. I shouldn't be dominating the conversation, but if there are comments or questions, please, you can just open your mic or you can type in the chat box if you're able to. One of the things we always, Elva, one of the things we always consider is barriers. Uh, how to overcome barriers at the system level, at the community level, at the individual level, obviously. But in your work and the work of the sector committee, um, someone wanting to work in this space, what's the biggest barrier that she or he will have to face kind of going to that lowest hanging fruit? It's like where do they find the step ladder to get to that lowest hanging fruit
Mhm.
to start with the messaging? Any thoughts on that?
I do, Bill. So I think to me, the biggest barrier that I feel we're facing is sustainment, because we were able to really implement the program successfully for 2 years, but that's with a lot of support from the university, right? But once the program stopped, once the grant stopped, we saw basically most physical activity programs in churches stop, right? So to me, a barrier is obviously making sure that we have the right partners who can help troubleshoot troubleshoot barriers of program implementation and sustainment. So maybe to get more sort of operational. We work closely with promotoras and we train them to deliver physical activity programs. But like life happens, promotoras end up finding another job. So we have to train another one in the church, to make sure that they have the capacity to lead physical activity classes. They can talk about safety. They can talk about obviously injury prevention and so forth. And sort of you really need a champion in the church to make sure that they sort of see that those transitions and those hiccups and those just disruptions in implementation, just work through them, right? So you really need somebody at the core, and I think those are hard to find people who are like, this is my priority and that's it.
Right.
So whose responsibility is it at the end? Is it the churches? Is it the other sectors who are helping support these programs? It's I don't know. It's if somebody has answers, I'd love to hear about it. Because I think that's sort of the challenge. I feel confident that we can start a program and get it going. Sustaining it to me is is to me a big,
Yeah, how do you change the system? That's a great, great point. 5 years of funding is one thing, but you can prove concept. But all of a sudden, when that goes away, have you actually really changed anything? I struggle with school PE like that a lot too. Interesting point though about promotoras. Obviously all along the U.S.-Mexico border in South Texas, they're prominent. Promotoras are prominent in community leaders and so forth. They're valued. Obviously, they're respected, and that may be another kind of strategy as a member of a church or a synagogue or a mosque or other kind of situation, religious situation, faith-based setting. They're a member of the community as well, and counting on their leadership. I think we might have just written a grant here because I think that's a huge how to affect the sustainability of these things rather than people from outside coming in, growing it from the inside to go out. I think is an interesting strategy. Um, Again, if you have any questions or comments, I'm not uh, I'm not afraid to end earlier than 2. We still got about 15 minutes and take advantage of Dr. Arredondo's wisdom here. On the other side of the coin, other than engaging the leader of the church, she or he who is responsible for delivering an organization and bringing people together and so forth, are there any, excuse me, are there any accelerants, any magic dust that we can kind of sprinkle on things that might speed up finding that low-hanging fruit? Is there anything that if you
yeah.
turn around 3 times and say some magic words that it would happen faster?
Oh, I wish it was that easy sometimes. But I mean, I think that there are characteristics of churches that have that are maybe more ready to implement a physical activity program. So they may be speaking of like lower hanging fruit in terms of like if a church is ready to go because they have the infrastructure and they have the support,
Yeah.
and the resources. I feel like that would probably be a good strategy. And then, so, figuring out ways to create some of that infrastructure. We know that health committees are in general representative of what the community wants. So if we can help facilitate one and form one, they could be responsible to making sure that some of these programs are being effectively implemented and sustained. So it's obviously a group of key stakeholders who are really engaged in the mission of health. So that I would say that if you're coming across a church that has one, it's probably a good sign that they may be more ready than others.
So almost like a organizational, motivational stage of readiness, right? Or stage of
Exactly.
motivational readiness, right? Trying to figure out
Exactly.
who's further along that continuum.
Yeah, and there are some research showing that like there are other indicators of organizational readiness. Having worked with other universities is another indicator that they know what they're getting themselves into. They understand the terms in general. They understand the benefits. They understand the challenges. So I think there may be less hesitancy, or they might understand more what it involves at a church that perhaps doesn't have the history. Churches that are much more connected to the community are much more ready to implement a physical activity program or health program in general. So if churches that are isolated may be less ready. But then I also feel like, well, maybe we should be developing strategies to help churches get more ready, right? But we still have to understand, it's still a lot in terms of church characteristics. We have some preliminary evidence as to what what can help us facilitate implementation, but not too much.
Yeah, a lot to do in this area. We're trying to fly the plane while we're building it. It sounds like oftentimes.
Yeah.
It's not a reason. That's not a reason to get on board, but it is something that we've got to be evidence informed and do what we can, but also trust our judgment here.
Yeah.
If there's no other questions, we can end a little bit early. I want to thank you very much. Oh, there is a question. I'm
Oh, there's
sorry.
a question.
Someone's got a hand up. Oh, Klaus.
Hi, Bill. It's good to see you.
Likewise. Thanks for joining.
Thank you.
What's on your
I'm,
mind?
I'm Klaus Madsen with Cities Changing Diabetes, and in Houston, we have worked to engage houses of faith in diabetes self-management education, and we have done that in a peer-to-peer training model using a DSMES curriculum from an FQHC in Laredo, and then putting all of that into a spirituality context, collaborating with the Institute for Spirituality and Health at the Texas Medical Center. And what we have learned is that houses of faith have no infrastructure to do health ministry. It's typically a couple of retired ladies, nurses maybe, that are organizing an annual health fair. They're running a grief group, and they're visiting members of the community of faith when they're in the hospital and when they come back. But they can't really get into to addressing larger public health issues like physical activity because they don't understand how. And so I recommend that we meet these houses of faith leaders, both laity and clergy, where they are. We help them with their health fairs, but then we say, maybe you should think about how to change the nutrition policy at the church, or maybe do a bike path around the temple, all that stuff. But it's really challenging to come in from the outside and say we as agencies or academia, we recommend that you do such and such. And there's a really important thing that we need to keep in mind, and that's the trust level. So there are many members of our community who do not trust health systems, who do not trust the government, who do not trust pharma, and so we need to find allies in these houses of faith that can be those champions. But it's a very long process.
Yeah.
And I have a couple of white papers on our journey in Houston that I can share with you, Bill, and we can follow up offline.
That'd be dynamite to help inform the plan in this particular area. Elva, you were saying, I'm sorry I interrupted you. I apologize.
Yeah, I mean, I really appreciate the comments because I feel like you said, that oftentimes these smaller churches that may not have the infrastructure, there's enthusiasm, and so how can we help them increase their capacity? And it may not involve full on physical activity program, or they may not have the community health workers to implement it, or they may still need to form partnerships with universities who can help offer that. But I think helping them to get to that readiness stage, it would be important. And what I've seen too, Klaus, is that I know I'm going to contradict myself by saying this, but I have to say it because I think it's an interesting observation. Even with the smaller churches, sometimes we've seen implementation happen really quickly because if the father, there's less red tape to go through before approval of a health program can be implemented. So, but if the father is on board, then it just happens quickly. If the father wants the classrooms to be used for physical activity, or the classroom, that's what's going to happen. Whereas in some of these other churches, larger churches, you have to talk to this committee first, and then after that committee gives it approval, you have to go to this other committee. So it was like sometimes, oh my gosh, what else do we need to do to like get this going? Whereas in the smaller churches, like, I love it, let's make it happen here. And then within a couple months, it was going. But we face other barriers that we didn't in the larger churches, like finding the people to do it and things like that.
Really like the idea of the peer-to-peer. It's not just in faith-based settings that's been shown to be helpful, but it's almost a homegrown deal. And the idea then is, the question then is how to start that snowball rolling, I guess. And it sounds like you've had some success, Klaus. I'd love to hear more about that.
I would love to do a conference call with you all where we can share our experience and what we have learned, and we can also bring some of the community stakeholders in that can talk about how we co-created the program back in 2017, 16 together, and then just like Ella was saying, some churches are ready to go, and we work with a itty bitty historic AME church in Houston, and they got 10% of their members involved in our program, and now they're very involved in vaccine awareness and other things. So it takes time to create that culture of health, and any entry that we have is an opportunity to work on other health matters. So I'll follow up with you, Bill, and maybe we can do a conference call or a webinar, or have some kind of further discussion. I would love that.
You got it. That's a great idea. Thanks. I don't want to cut this off, but Jack Voss has his hand up. Jack, do you have access to a microphone? Jack, I don't know if you can hear me or not, but you see your hands up. If you got access to a microphone, please go ahead and open it. If not, you can type in the chat box as well, or you can always email too, and at the email address at the bottom of the slide here, and we'll be able to post your comments and so forth. As we wrap up here, excuse me. As we wrap up, Liv has posted. I guess Liv had. Oh no, she's still here. She's posted a link to previous webinars in the series on the Michael and Susan Dell Center website. You can see the recordings as well as the PowerPoints from the previous ones, and the four future ones that beginning tomorrow with transportation and land use as a societal sector as well. So
where's that on, Phil? I'm sorry, I don't see it.
Liv, you want to past webinar? It's the first post in the chat box.
Okay, gotcha.
I'll copy it and paste it again for convenience.
Oh, I see. Thank you.
But we've got a wealth of knowledge and information that the experts have shared with us, and we'll continue to. There we go. To ponder as we bring together. Oh, there's Jack. IT problems. That's the story of the last 2.5 years, right? IT problems. But Jack, please, if you want to get your comments in, please email me at that address, and we'll make sure we include them. Anyway, Dr. Arredondo, thank you so very, very much for sharing an hour out of your busy schedule with us today, and giving us some guidance in the faith-based settings for physical activity planning. It's been extremely helpful. I want to thank the participants as well as the School of Public Health, the Michael and Susan Dell Center, the State Department of Health Services in Texas, and the Physical Activity Alliance, where I also posted a link if you'd like to go see more on the national plan or the Physical Activity Alliance. I hope you all have a great afternoon, and again, thanks.